Have you been struggling with sluggish digestion, irregular bowel movements, or that heavy, uncomfortable feeling in your stomach? What if the real reason isn't just fiber or water, but something you're missing every day? The truth is, certain vitamin deficiencies can silently slow down your gut and trap waste longer than it should. But the good news? Just by correcting 5 specific vitamin gaps, you can help your body move things along, naturally, gently, and effectively. Now let's break it down. You're watching Health is Wealth, the place where smart, science-backed health knowledge becomes simple and actionable. Subscribe and turn on the bell so you never miss a tip that could improve your digestion, energy, and long-term wellness. Now, let's dive into the first vitamin that could be making, or breaking, your bathroom routine. You probably know vitamin A for vision and immunity. But did you know it plays a quiet yet essential role in keeping your gut lining healthy and moving? 1. What vitamin A does in your gut. Vitamin A supports the health of the mucosal lining of your intestines. This is the inner wall that keeps digestion smooth and efficient. When the lining is inflamed, dry, or damaged, bowel movements become harder, more painful, and less frequent. Vitamin A also influences the secretion of mucus, which acts as a natural lubricant in the colon. Without adequate mucus, waste moves slower, making stool dry and difficult to pass. 2. Deficiency and constipation. Low levels of vitamin A are linked to increased risk of gastrointestinal disorders, including chronic constipation. A compromised intestinal lining can lead to poor nutrient absorption, reduced gut motility, more strain during bowel movements. In severe cases, a lack of vitamin A may even contribute to intestinal inflammation or infection, both of which worsen digestive sluggishness. 3. How much you need. The recommended daily intake of vitamin A varies by age and gender. Adult men, 900 micrograms per day. Adult women, 700 micrograms per day. However, needs may increase if you're recovering from illness, dealing with gut inflammation, or on a low-fat diet that impairs vitamin absorption. 4. Natural sources of vitamin A. There are 2 main forms of vitamin A. Preformed vitamin A, retinol, found in animal sources like liver, eggs, and dairy. Provitamin A, beta-carotene, found in plant-based foods like carrots, sweet potatoes, and spinach. Top food sources to support gut health include cooked carrots, pumpkin, kale and collard greens, egg yolks, liver, in small amounts. 5. Bonus tip, fat helps absorption. Vitamin A is fat-soluble, which means it needs dietary fat to be absorbed. So if you're eating lots of vitamin A-rich veggies but avoiding all fats, your body might not be getting the benefit. Try pairing carrots with olive oil, or spinach with avocado for maximum gut-boosting results. Vitamin A keeps your gut lining smooth and slippery. But what about the muscles of your intestines, the ones that physically push waste out? That's where the next vitamin comes in, and it's one that nearly everyone is low on without realizing it. Vitamin B1, the spark plug of gut motility. If your digestive system feels like it's crawling instead of flowing, there's a strong chance your body is lacking one of its key energy drivers, vitamin B1, also known as thiamine. This unassuming B vitamin powers the nerves and muscles in your digestive tract. Without enough of it, your intestines can't move food along efficiently. 1. The nervous system connection. Thiamine plays a direct role in the proper functioning of the nervous system, which is deeply connected to your gut through what's known as the enteric nervous system, often referred to as the second brain. This network of nerves controls the rhythmic contractions of the intestinal wall, known as peristalsis. If thiamine levels are low, these contractions slow down or become uncoordinated. The result? Delayed digestion and more frequent constipation. 2. Energy production for digestion. Vitamin B1 is essential in converting carbohydrates into energy. The entire digestive process, starting from chewing to the final elimination, relies on cellular energy. Without enough thiamine, even a fiber-rich diet might not help much, because the muscles of the gut lack the fuel they need to do their job. Symptoms of thiamine deficiency that often go unnoticed include fatigue, poor appetite, bloating, sluggish bowel movement. When combined, these can create the perfect storm for chronic constipation. 3. Recommended daily intake. Adult men, 1.2 mg per day. Adult women, 1.1 mg per day. While the numbers seem small, thiamine is water-soluble and not stored well in the body. That means you need to replenish it regularly through diet. 4. Common causes of low thiamine. You may be low on vitamin B1 if you consume excessive alcohol. You eat a high-sugar, low-nutrient diet. You have chronic digestive disorders like IBS or Crohn's. You take diuretics or certain antibiotics. Even mild thiamine deficiency can reduce gut motility and increase constipation risk. 5. Best food sources of thiamine. Whole, minimally processed foods are your best bet. Sunflower seeds, green peas, lentils, brown rice, pork, fortified cereals and whole grains. 6. Caution with excess carbs. Thiamine is needed to metabolize carbohydrates. If you eat a high-carb diet without enough B1, you increase your risk of depletion. This is especially true for people who consume a lot of white rice, processed bread, or sugary snacks, foods that require thiamine to process but don't provide any themselves. 7. Bonus: why energy and digestion are linked. Your intestines aren't just passive tubes, they're muscle-based systems that rely on constant, low-level energy output. If your body's fuel tank is empty, the entire digestive process, from enzyme release to waste removal, slows to a crawl. Transition to next section. So far, we've supported your gut lining and rebooted your intestinal movement. But now it's time to look at the vitamin that directly controls the moisture content of your stool. Without it, things dry up, and that's when constipation hits hard. Coming up next, the most underestimated hydration hero, vitamin C. Vitamin C, the hydration hero for softer, easier stools. When most people think of vitamin C, they imagine immune support or cold prevention. But few realize that this powerful antioxidant is also a silent force in digestive regularity, especially when it comes to softening stools and preventing constipation. 1. How vitamin C helps with constipation. Vitamin C promotes bowel movement in two key ways. Water attraction, osmotic effect. High doses of vitamin C pull water into the intestines. This added fluid softens the stool and stimulates the bowels to contract, helping waste pass more easily. Stimulation of peristalsis. It indirectly stimulates peristalsis, the wave-like muscle contractions that move waste through the colon. When these contractions are weak or slow, constipation becomes a regular problem. 2. A natural osmotic laxative, without the side effects. Unlike synthetic laxatives that can be harsh and habit-forming, vitamin C works gently by improving stool hydration. This helps the stool remain soft and easier to eliminate without straining. Many doctors actually recommend vitamin C loading as a natural remedy for occasional constipation. It involves gradually increasing the dose until you reach bowel tolerance, where your body signals enough through looser stools. 3. Signs you may need more vitamin C for digestion. Dry, hard, or pellet-like stools. Infrequent bowel movements. Straining during defecation. Fatigue and slow recovery. Bleeding gums or easy bruising, also signs of deficiency. If you're seeing these issues regularly, increasing your vitamin C intake could make a noticeable difference. 4. Recommended daily intake, minimum. Adult men, 90 mg per day. Adult women, 75 mg per day. However, for digestive support, higher amounts, between 500 mg to 2000 mg per day, may be more beneficial, especially under supervision. 5. Best food sources of vitamin C. Eat these daily for natural digestive hydration. Kiwi. Oranges and citrus fruits. Strawberries. Red bell peppers. Papaya. Broccoli. Kale. Brussels sprouts. These fruits and vegetables also provide dietary fiber, which amplifies their constipation-fighting power. 6. Supplemental forms and absorption tips. If you take vitamin C supplements, consider these forms. Ascorbic acid, most common. Sodium ascorbate, gentler on the stomach. Liposomal vitamin C, enhanced absorption. Tip: take it with meals and plenty of water to improve tolerance and absorption. 7. Important note on bowel tolerance. If you're using vitamin C to help with constipation, you may gradually increase your intake by 250 to 500 mg per day until you feel a shift in bowel regularity. Once you reach the point of loose stools, reduce to the last comfortable level. This personalized method works well for many, but always consult your doctor before high dosing, especially if you have kidney issues or take certain medications. Transition to next section. So far, we've energized your gut and softened your stools, but now it's time to boost the bacteria that manage everything from digestion to nutrient absorption. Let's explore the vitamin that feeds your good gut microbes and reduces inflammation in your digestive system, vitamin D. Vitamin D, the microbiome balancer for long-term digestive health. Vitamin D is often labeled as the sunshine vitamin for its role in bone health and immunity. But emerging research shows it also plays a crucial role in gut motility, inflammation control, and microbiome stability, all of which are essential to preventing chronic constipation. 1. How vitamin D supports regular digestion. Modulates the gut microbiota. Healthy bowel movements depend on a well-balanced gut microbiome. Vitamin D helps regulate bacterial diversity in the colon, especially boosting populations of beneficial strains like lactobacillus and bifidobacteria. These microbes break down fiber into short-chain fatty acids that keep the colon healthy and motile. Reduces intestinal inflammation. Chronic gut inflammation can slow peristalsis and lead to sluggish bowels. Vitamin D acts as a natural anti-inflammatory by suppressing overactive immune responses in the intestinal lining, creating a smoother, irritation-free digestive process. Improves nervous system function in the gut. The gastrointestinal tract is lined with its own nervous system, sometimes called the second brain. Vitamin D enhances nerve signaling in the colon, helping initiate and maintain the muscle contractions needed to pass waste efficiently. 2. Link between vitamin D deficiency and constipation. Low levels of vitamin D are increasingly associated with chronic constipation and irritable bowel syndrome, IBS, especially the IBS-C subtype, constipation dominant. People with vitamin D deficiency tend to report more bloating, straining, and incomplete bowel movements. Deficiency also affects the gut-brain axis, disrupting the communication between the brain and intestines, a key reason why constipation can feel both physical and emotional. 3. Signs you may be deficient in vitamin D. Constipation or sluggish digestion. Frequent illness or low immunity. Bone pain or muscle weakness. Low mood, especially in winter. Fatigue despite rest. If you're experiencing multiple symptoms, it's important to check your vitamin D levels through a blood test. 4. Recommended daily intake, minimum. Adults under 70, 600 IU/day. Adults over 70, 800 IU/day. For optimal gut health, many experts suggest 1000 to 2000 IU/day, especially for those who get little sun exposure. 5. Best food sources of vitamin D. Natural sources are limited, but here are some rich options. Fatty fish, salmon, sardines, mackerel. Cod liver oil. Egg yolks. Fortified dairy and plant milks. Fortified cereals. Mushrooms exposed to UV light. 6. Sunlight exposure, nature's way to boost vitamin D. Just 15 to 20 minutes of direct sunlight on your skin, a few times per week, can trigger vitamin D production naturally. However, factors like sunscreen, darker skin tone, and latitude reduce this effect. That's why supplementation is often necessary. 7. Supplementation tips. Choose vitamin D3, cholecalciferol, over D2, it's more potent and longer lasting in the body. Take it with a meal containing fat to enhance absorption. Combine with magnesium if possible. Magnesium helps activate vitamin D in your body. 8. Safety note. Avoid excessive doses without supervision. While vitamin D toxicity is rare, extremely high levels over time can lead to calcium buildup and kidney issues. Stay within the safe upper limit of 4,000 IU/day, unless directed by your healthcare provider. Transition to final section. Vitamin D helps regulate your gut microbiome, reduce inflammation, and optimize nerve signals for bowel movements. But the last vitamin on our list is the one that keeps those muscles contracting and your colon moving like clockwork. Let's close this series with vitamin B1, your body's electrical signal for regularity. Vitamin B9, also known as folate, plays a central role in maintaining a healthy digestive system, especially when it comes to fighting off chronic constipation. At its core, folate is essential for cell division and tissue regeneration, which are vital for keeping your intestinal lining strong and functional. The lining of your gut, called the intestinal mucosa, is constantly renewing itself. This tissue faces daily wear and tear from food, stomach acid, gut bacteria, and environmental toxins. Without adequate folate, your body struggles to replace these cells, leaving the intestinal wall weak, inflamed, and less efficient at absorbing nutrients and eliminating waste. Why does this matter for constipation? Because when the intestinal lining is damaged or underperforming, everything slows down, from digestion to the natural movement of waste through your colon. In short, low folate can mean sluggish bowels and harder stools, even if you're eating plenty of fiber. But there's more. Folate is also responsible for regulating levels of a compound called homocysteine in the blood. Elevated homocysteine has been linked to systemic inflammation and vascular issues, both of which can affect nerve and muscle function, including those that control your gut. When your gut's neural communication is off, the rhythmic contractions, peristalsis, that move stool along can weaken. Folate also supports the production of healthy red blood cells, which carry oxygen to all the tissues in your body, including your intestines. Poor oxygenation due to folate deficiency can further impair the smooth muscles responsible for bowel movements, compounding the problem. So where can you get folate? It's abundant in dark leafy greens such as spinach, kale, romaine lettuce, and collard greens. You'll also find it in legumes like lentils, chickpeas, black beans, and pinto beans. Avocados, asparagus, beets, and broccoli are also great sources. For non-vegetarian options, organ meats such as liver provide concentrated amounts of folate. Citrus fruits like oranges, grapefruits, and lemons contribute moderate amounts of folate as well, and many grain-based foods today are fortified with folic acid, the synthetic form of folate. For older adults, especially those taking certain medications, like antacids, anti-seizure drugs, or methotrexate, folate absorption can become compromised. In such cases, folate supplements may be necessary, but these should always be taken under medical supervision, as improper use can mask other deficiencies such as vitamin B12. In summary, vitamin B9 isn't just about preventing birth defects, it's one of your gut's best allies. By fueling cell regeneration, promoting oxygen delivery, and supporting nerve-muscle communication in the intestines, folate works at multiple levels to help your body fight constipation naturally and effectively. Transit times and improved bowel frequency. Let's recap the 5 most important vitamins to naturally prevent constipation and keep your digestive system running efficiently. Vitamin C, for softening stools and speeding up transit. Vitamin B12, for nerve-based bowel coordination. Magnesium, the gentle laxative mineral for regular flow. Vitamin D, for microbiome regulation and anti-inflammatory effects. Vitamin B1, the neuromuscular spark that triggers movement. Each of these nutrients works in its own way, but together, they form a powerful toolkit against sluggish digestion. Whether you're dealing with occasional constipation or chronic issues, supporting your body through these essential vitamins is a smart, sustainable step toward long-term gut health. Remember, supplements can help, but food-first strategies always build stronger foundations. Focus on nutrient-dense meals, hydration, daily movement, and stress management. Constipation is not just a digestive problem, it's a sign your body may be missing key signals at a much deeper level. If you found this video helpful, please like, share, and subscribe to Health is Wealth. Every week, we bring you real science-backed tips to help you live better from the inside out. Stay regular, stay healthy, and see you in the next video.